68-year-old woman holds two Medicare cards. One costs $17 a month. The other costs $300. She picked the cheap one. And for 5 years, it worked perfectly. Then the diagnosis came, and that $17 decision locked her out of the coverage she actually needed. By the time she discovered the trap, it was already too late. Most seniors never realize what they've agreed to until they try to leave. This is the choice every 65-year-old in America has to make, and nearly 33 million of them have already made it. Medicare Advantage or Original Medicare with a Medigap policy, one is easy to get into. The other is nearly impossible to switch to later, and what looks like a simple budget decision when you are healthy becomes something else entirely when you are not. Let's start with a simple budget decision because that's exactly what it looks like on paper. When you turn 65, you get a mailbox full of envelopes. Medicare Advantage plans that cost nothing extra per month, or maybe $17 if you want the premium package that includes dental and a gym membership. Then you see the other option. Original Medicare, Parts A and B, plus a Medigap supplement plan to cover what Medicare doesn't. Between the Part B premium everyone pays and the Medigap policy, you are looking at $300 a month, sometimes more. It's not even close on the math. The woman from the cards, we'll call her Rita. When Rita turned 65, she ran those numbers. $17 versus $300. Advantage also threw in hearing aids and a quarterly allowance for over-the-counter items. Medigap offered no extras, just the promise that if she got sick, she could see any doctor in America who accepts Medicare. No referrals, no networks, no prior authorizations. Rita didn't think she'd need all that. She was healthy. She walked 3 miles every morning. She chose the cheaper card. And for 5 years, it worked perfectly. Then the diagnosis came, a slow-growing thing that had been hiding. And suddenly Rita needed specialists. The kind that might be at a university hospital 2 states away. The kind that don't take all insurance plans. She pulled out her Advantage card and started looking up providers. Half the names on her doctor's referral list were out of network. The specialist she actually wanted didn't accept her plan at all. That's when Rita remembered the other option, Original Medicare plus Medigap. She could see anyone. She called an insurance agent and said she wanted to switch. The agent asked a question that made her stomach drop. He asked when she turned 65. She said 5 years ago. Then he asked the second question, and when she answered, he told her the truth. That $17 decision she made when she was healthy had already locked the door, and the key had disappeared 60 days after she stopped walking those 3 miles every morning. Let me explain what just happened to Rita, because it's not a loophole buried in fine print. It is the law. When you first become eligible for Medicare, you get a one-time window, 6 months, starting the month you enroll in Part B. During those 6 months, any Medigap insurer in your state must sell you any policy they offer. No questions about your health. No higher premiums for a pre-existing condition. You cannot be denied. That window is called guaranteed issue. After those 6 months close, the barrier drops. And from that point forward, the insurance company is allowed to look at your medical history before they decide whether to cover you. That is medical underwriting. And if you have something serious in your chart, congestive heart failure, cancer, diabetes with complications, they can simply say no. Now, if you had signed up for Medigap during that 6-month window, you would have locked in permanent coverage. It would renew every year. No underwriting ever again for the rest of your life. But Rita didn't do that. She chose a Medicare Advantage plan, which looked like a better deal because the premium was so low. What she didn't know is that if you want to switch from Advantage back to Original Medicare and add Medigap later, there are only a few narrow circumstances where you get another guaranteed issue window. The most common is the trial right. If you join an Advantage plan right when you first enroll in Medicare, you have 12 months to change your mind. Within those 12 months, you can switch back and buy any Medigap policy without underwriting. After 12 months, the door closes. Rita was 5 years in. This matters because Medicare Advantage is not the same thing as Original Medicare. Advantage plans are private insurance. They control which doctors you can see, what medicines are covered, and what treatments they will approve. If you need a specialist, you often need a referral from a primary care doctor. If you need a procedure, the insurer gets to decide whether it's medically necessary. That decision is called prior authorization. And according to the Health Affairs Journal, in 2019, 1 out of every 6 prior authorization requests was initially denied. 1 out of 6. That's 17%. And those initial denials had real consequences. A report from the Department of Health and Human Services found that when a nursing home stay was denied, the median time for an appeal was 6 days. For 17% of patients, the wait was 10 days or longer. Days sitting in a hospital bed, ready for discharge, waiting for an insurance company to decide whether to pay. And here is the part that reveals the system's true design. Medicare Advantage plans are paid a flat monthly fee by the government for each enrollee. It's called a capitation payment. The plan keeps whatever it doesn't spend on your care. So every denied prior authorization, every delayed specialist visit, every out-of-network surprise bill, it all flows back to the bottom line. The incentive is not to cover care. The incentive is to manage it down. Rita discovered this the hard way when her specialist's office told her the prior authorization was denied. She had to wait, file an appeal, find a new doctor who would accept her plan's network. And by the time she got the care she needed, she had lost months. All while the clock had already run out on her ability to get a Medigap policy without passing a medical exam she could no longer pass. Now you might be asking, if the system is this stacked, why do tens of millions of seniors pick Medicare Advantage? And the answer to that question will make you angry, because the system was designed to look like a gift while hiding the bill. Let me show you exactly who benefits from Rita being trapped, and what they spent to make sure she never asked the right question. The people who benefit from Rita being trapped are the same people who spent more than $400 million over the last decade to make sure you never ask the right question. And they did it with television commercials, celebrity endorsements, and a single phrase that sounds like the safest thing in the world: $0 premium. Here is what that $0 actually buys. Every year, the Centers for Medicare and Medicaid Services pays your Medicare Advantage plan between $10,000 and $14,000 per enrollee. That's your tax money, handed to a private insurance company with one instruction: manage this senior's care. The plan keeps whatever it does not spend. If they deny a surgery, they keep the money. If they delay a nursing home stay for 6 days, they keep the money. If they require a specialist referral that takes 3 months to schedule, they keep the money. The financial incentive is not to provide care. It is to restrict access to care with enough legal cover to avoid looking like they're doing it on purpose. This is not speculation. It's math. The Health Affairs study that found 1 in 6 claims were denied also found that total provider payments dropped by 7% because of denials that were never overturned. That 7% is not a rounding error. That's billions of dollars that stayed inside the insurance companies instead of going to hospitals and doctors. And every dollar they keep adds up in the quarterly earnings report and the stock price. Now, if this system were truly voluntary, if people could simply switch to Original Medicare and buy a Medigap policy whenever they wanted, the Advantage plans would have to compete on quality. They would have to prove their networks were better, their prior authorizations were faster, their denials were fairer. But they don't, because they don't have to. The exit door is bolted shut, and they know it. Let me read you the exact language from the federal regulation. Federal law does not require Medigap insurers to issue Medigap policies to people who choose to disenroll from a Medicare Advantage plan, except under limited circumstances. Translation: if you pick the wrong plan when you are 65 and you get cancer at 72, the Medigap insurer can look at your chart and say no. You are not entitled to a second chance. The limited circumstances they mention sound generous but vanish fast. The 12-month trial right, the 5-star special enrollment period if you want to switch to a highly rated plan, and a handful of other narrow windows. But if you live in a state that hasn't passed its own protections, and most haven't, none of those apply if you just change your mind after a diagnosis. The insurance industry spent decades shaping this rule, and they made sure the escape hatches were small enough to be invisible until it was too late. Miranda Yaver, a health policy professor at the University of Pittsburgh, looked at the denial data and put it bluntly. She said, "These denial rates are quite staggering. It reinforces what a lot of Americans have already been articulating a lot of frustration about, that healthcare decisions are being made with profit rather than medical necessity in mind." She said that after seeing the numbers, the insurance industry heard the same numbers and sent a different message: keep marketing. In the fall of each year, Medicare's open enrollment arrives, and the airwaves fill with ads. Joe Namath telling you to call the number on your screen, seniors dancing in a park, promises of dental, vision, hearing, and a flex card for groceries. Last year, insurers spent over $1 billion on Medicare Advantage advertising. $1 billion. And not one of those commercials mentioned the word underwriting. Not one mentioned that if you sign up today and get sick tomorrow, you could be stuck for life. This brings me to a 16-digit number: 15%. According to the Kaiser Family Foundation, 15% of local PPO Medicare Advantage plans were canceled outright for 2026. That means millions of seniors showed up to their doctor's office in January and found out their plan no longer existed. They were automatically moved to a new plan with a new network, new prior authorization rules, and new specialists they might no longer be allowed to see. And if the new network didn't include the oncologist who had been treating them for 2 years, their only option was to find a new doctor who would start from scratch. They could not walk over to Original Medicare and buy a Medigap policy. The system had them, and it wasn't letting go. So the question isn't whether Medicare Advantage is bad for everyone. For some people, it works fine because they stay healthy. The question is, what happens when you don't? And the answer to that question has a name. His name is Richard. He's 70 years old. And when his test results came back, he had 2 choices: fight the disease or fight the insurance company. He did not expect to do both at the same time. Richard enrolled in a Medicare Advantage plan the month he turned 65. The premium was $0. His brother, who was already on Original Medicare with a Medigap policy, paid $340 a month. Richard thought his brother was wasting money. He said so at Thanksgiving. 2 years later, Richard started losing weight without trying. His doctor ordered a CT scan. The Advantage plan required prior authorization. It took 11 days to get approval. The scan found a mass on his pancreas. He needed a specialist at a major cancer center 2 hours from his home. The specialist's office checked his insurance and said they did not accept his plan. The in-network oncologist the plan assigned to him had a 3-month wait for new patients. 3 months. Richard's wife started making phone calls. She called the plan. She called the state insurance department. She called a Medicare counselor. Every conversation ended the same way. He could switch back to Original Medicare. That part was easy, but when he tried to buy a Medigap policy, the insurance company asked for his medical records. They saw the CT scan, the diagnosis, the staging, and they declined to offer him coverage at any price. This is not a hypothetical. This is the system working exactly as designed. And if you are within 5 years of turning 65, or you have a parent who is what I am about to tell you might be the most important financial decision you will ever make around a kitchen table, there are exactly 3 questions you need to ask before you pick a Medicare plan. Not later, before. Question 1, does this plan limit which doctors I can see? If the answer is yes, there is a network. Ask for a printed provider directory dated within the last 90 days. Question 2, does this plan require prior authorization for specialists, imaging, and procedures? If yes, ask what the average turnaround time is and what percentage are initially denied. Question 3, and this is the one nobody tells you about. If I get sick and want to switch to Original Medicare with Medigap later, what will I need to do? If the answer does not include a detailed explanation of the 6-month Medigap open enrollment window and the 12-month Advantage trial, right, walk away and talk to someone who will give you that explanation. Because that window is everything. The federal guaranteed issue period runs for 6 months starting the month you enroll in Medicare Part B. During that time, you can buy any Medigap plan sold in your state. No questions asked. If you choose an Advantage plan first, the trial right gives you 12 months to switch back. After those windows close, you are at the mercy of medical underwriting in most states. And once a diagnosis hits your record, underwriting is no longer a formality. It is a wall. Now, there is one detail that makes this system slightly less merciless, but only if you know about it. Some states have passed their own protections. In Massachusetts, there is an annual guaranteed issue open enrollment period every year from February 1st through March 31st. In Missouri, the anniversary rule lets you switch to the same letter plan from a different insurer during a 30-day window each year without underwriting. If you live in a state that has broadened these rights, you have more flexibility. If you don't, you have almost none. And most Americans don't. So, the decision you make in the months around your 65th birthday will determine how much control you have over your health care for the rest of your life. And now, for the surprising number that has not appeared in any insurance company commercial ever. According to an analysis by the Henry J. Kaiser Family Foundation, most people approaching Medicare age cannot correctly identify what Medigap is when the enrollment window opens, or what underwriting means for their future coverage. The very people who need this information the most do not know it exists. And the companies that profit from their confusion spend $1 billion a year making sure it stays that way. So here is where we are. Rita is still waiting for the specialist who takes her plan. Richard is fighting two battles at once, one against his body and one against an insurer's bottom line, and millions of other seniors are one diagnosis away from joining them, holding a $17 card that promised them everything and delivered a locked door. But there is one more thing you need to know about this system. Something that connects the Medicare enrollment decision to a much larger question about who gets to decide what your health is worth. And it starts with a law that was written in a way that benefits everyone except you. The law is the Social Security Amendments of 1965, which created Medicare. It is also every update since, every regulation shaped by insurance lobbyists, every congressional hearing where a well-paid advocate explained why medical underwriting protects the stability of the market. Stability in that sentence means the insurance company's right to say no to a sick person. It is a law built to look like a safety net, but it has a trapdoor installed at the factory, and nobody tells you it's there until you've already fallen through. Rita didn't know, Richard didn't know, and millions of people watching this right now didn't know. But now you do. The question is what you do with it, because the decision that locks you in or keeps you free isn't made when you get sick. It's made when you are 65 and healthy and holding two cards you barely understand. That moment is everything. If this information landed the way I think it did, then you are exactly the kind of person I built something for. In the first pinned comment below, there's a link to a Medicare Advantage versus original Medicare comparison worksheet. It walks you through the 3 questions, the enrollment windows, and the deadlines, step by step. No email required, no paywall. It's just there. Because the people who profit from your confusion will never hand you a map, but I will. Hit subscribe and share this with one person who needs to see it. I'll see you in the next one.